Years, UAB Hospital has been known, of course, for their top-tier medical care and clinical trials, and now they're reaching out to more Alabamians like you, sharing the benefits of signing up to take part in these clinical trials. Dr. Barry Sleckman, director of the O'Neal Comprehensive Cancer Center, is here this morning to talk about this. Dr. Sleckman, good morning.
Good morning, Janice. Great to be here.
It's good to see you. I think we hear the term clinical trial, but not all the time we know exactly what that means. So first, talk to us about what a clinical trial is.
Yeah, this is extremely important. So a clinical trial is where we're testing a potential new treatment, in our case for cancer patients. The way we design a trial, let's say it's for lung cancer, is we would take 100 patients with lung cancer, we divide them into two groups of 50. Both groups would get standard of care. So that's extremely important. Both groups are being treated with the current standard for lung cancer. One group will get a new experimental drug and the other group will not get that drug. And then we'll compare the outcome of the 50 that got standard of care plus the experimental drug to the 50 that got just standard of care.
I would assume clinical trials have been going on a lot longer than we've ever talked about it, and that's how we get to new medications, right?
Yeah.
But more so now, or no?
Yeah, well, there are a lot more clinical trials now, and those are a product of all the research that's being done into cancer and improving our understanding in the laboratory, which then is tested and translated in a clinical trial. I think the important thing to realize about trials now versus, say, 30 years ago when I started in medicine is that both sets of those trials were important to learn new things about treating patients in the future, and they still are. But more and more today in cancer, patients who are on those trials are themselves having good outcomes. Because let's say you were in that group of 50 lung cancer patients, and that new additional treatment was actually beneficial and was saving lives. You would not only provide information for subsequent lung cancer patients, because that would become standard of care, but you yourself would be alive because you got that treatment in the trial. There are thousands and thousands of cancer survivors walking around today because they had a good outcome themselves as part of a clinical trial.
How do you decide who is a good candidate for a clinical trial?
Well, clinical trials, really, in essence, it's a test of something. So the person who designs the trial decides exactly what the parameters are for the patient to be in it. So when we talked about lung cancer patients, it's not just if you have lung cancer, you go in the trial. It's the type of lung cancer. It's the stage of lung cancer. It could be whether or not you had surgery before you were treated. So trials are designed to test new therapies based on the understanding of the way that therapy works. So a subset of patients with a particular cancer will be appropriate for that trial.
We have to wrap up, but one quick answer. Anyone watching now, maybe going through something, maybe thinking about being a part of a trial, what should they do?
Well, I tell people all over the country that if you have cancer, you need to be seen at an NCI designated cancer center. The thing that differentiates cancer centers that are designated by the NCI from others is that we are held to the standard of providing clinical trials for our patients. And the O'Neal Comprehensive Cancer Center at UAB is the only NCI designated cancer center in this state.
So I guess ask for your doctor to reference you or make a call yourself if you were found yourself.
Absolutely.
Fascinating. Thank you for the work that you do.
Yeah, it's
saving
great.
lives all the time.
Great being here.
Thank you so much. Dr. Sleckman from UAB. We'll take a break. We'll be right back.